Unfortunately, pressure injuries or bed sores are something that I'm a little too familiar with as an ICU nurse. Let's talk about what a bed sore is. Bed sores are pressure injuries, and they are caused by, as you can guess, pressure. I want you to think like when you have a really tight ponytail on your wrist and you like sleep with it on, you wake up and you notice that you have like this ring around your wrist. That is somewhat of like the beginning stages of a pressure injury, because if you were to leave that on for a long time, you would start to get that skin breakdown and it would eventually, erode away at your skin. But that's not the only thing that can cause a pressure injury. Obviously, there's a lot of different things that can cause pressure injuries. In particular, patients that are immobile, laying in bed, are at increased risk for developing these pressure injuries. You can also get them from medical devices as well, even something as simple as wearing a nasal cannula of oxygen. I've seen people get pressure injuries kind of right here behind their ears. The pressure is one thing that causes these injuries, but friction, shearing, staying in one place for a long time, poor nutrition contributes when patients, soil themselves and don't get cleaned up. All of these things kind of play a role into increasing someone's risk of pressure injuries. There are 4 stages of pressure injuries, stage 1 being the most mild and stage 4 being through several layers of the skin and the most severe. You can get a pressure injury pretty much any place on your body, but some of the most common places I have seen them are definitely on the patient's sacrum, on their backside, on their heels from laying their heels on the bed for too long. During COVID, when patients were prone and they're laying on their cheeks for a long time, we saw them a lot on the noses, on their cheeks, on their chins. Pressure injuries are preventable. However, I do want to add this in because I know we preach that they're preventable, and they are to a certain extent, but we are also limited as nurses to our resources around us. Best prevention method is going to be to change our patient's position at least every 2 hours to offset the pressure that on the one side that they're currently on. We can do this by turning people, putting pillows or wedges under one side, coming back 2 hours later, turning them to a different position, offloading their heels, paying close attention to any, medical devices that are on the patient, making sure that they are not pressing into the skin. And if they are, we are moving them around every 2 hours, or, putting some sort of barrier cream or dressing. Also going to insert a picture here really quick. So if you're squeamish, please exit out. So this is one example of a stage 4 pressure injury. As you can see, it is all the way down to the patient's bone. This is another example as well. I saw online that this one had just been debrided, so it actually looks bad, but it's nice and clean. If you know wounds, you can look at this and go, okay, that looks like a pretty healthy wound bed. These things can heal, but as you imagine, it takes a lot of time, and the best thing is going to be to keep pressure off of that site, keeping it clean, doing your dressing changes, debriding any dead tissue. Sometimes these need to go in and actually get surgically debrided and cleaned out and put a wound vac on them. Good nutrition. Yeah, that's my little 2 cents on pressure injuries.